Welcome everyone to today's webinar, Advancing the Health of Underserved Populations. I am Brian Zimmerman with Becker's Hospital Review. We'll begin today's webinar with a presentation, and we'll have time at the end for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. There will also be polling questions throughout the webinar. You can participate by clicking the answer that best applies. Thanks in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. And at this time, I'm pleased to introduce our speakers. So Brian Vaughn is the Senior Vice President, Health Systems for LabCorp Diagnostics. In this role, he is responsible for enterprise partnerships with health systems and value-based care organizations. He holds a BA in economics from Vanderbilt University and an MBA in health sector management from Duke University. Linda Fraunhofer is a Director of Population Health Initiatives within Value-Based Care at LabCorp, focusing on federally qualified health centers and public health departments. She holds an MS in biotechnology from the University of Wisconsin-Madison and is currently a PhD student in public and community health at the Medical College of Wisconsin. Brian, the floor is yours.
Well, thank you, Brian. And on behalf of Linda and I and our LabCorp colleagues, thank you, everybody, for joining us this afternoon to talk about this important topic, addressing the health of underserved populations, and especially how a laboratory can contribute to the support of community health initiatives. So Linda and I are going to go through really two things. First, I'm going to talk a little bit about LabCorp and some of the higher level things that we do to support our communities. And then I will hand it over to Linda, who's going to talk about a series of more specific ways in which we programmatically or by the use of our laboratory data help drive the health of our communities, oftentimes in partnership with many people who are on the phone today. So we'll jump right in. Next slide, please. So just a bit about LabCorp and our background. LabCorp operates two business segments, LabCorp Diagnostics, who I'm sure many of you are aware of, and Covance by LabCorp, which is soon to be LabCorp Drug Development, which is a global contract research organization. And through these two business units, we really focus on bringing science and the best quality of new science and innovation to human beings through our diagnostics business and then through partnering with biopharma and medical device organizations to bring new therapeutics to patients. Next slide. We often look at our impact and the way that we impact our clients and the patients that we serve through the number of patients that we serve. We touch 160 million patient encounters every single year, and our 70,000 employees around the globe, I know, take a lot of pride in the ability to touch that many patient lives every year. We're also very proud of the recognition that we've received, both about how innovative our company has been, how we're a great place to work, and of course, the recognition of some of our leaders in their fields. Amy Sumi, our Chief Marketing Officer, being recognized in her field, our Chief Scientific Officer, Dr. Marcia Eisenberg, and of course, a number of scientific and medical colleagues being recognized in their field all the time and publishing in their field. And we're really proud of these individuals and our organization as a whole and the impact we're able to have. Next slide. So we sit here in June of 2021 with last year and everything that we went through as some of our backdrop, right? The pandemic really laid bare health disparities that have been there for a really long time, but we saw them in just really stark relief. We saw through a series of really tragic events how racially unequal we are and how far we have to go in this country. And against that backdrop, we see organizations, private organizations, public health organizations, government organizations pledging to do more and do better. And so we see those organizations trying to reemphasize and double down on the things that they're doing. I know LabCorp is doing this as well, and many of the organizations that you work for are doing this as well to try and bring better health outcomes to the communities that we serve. So this is the backdrop in which we all operate. And so Linda and I look forward to showing you some of the things that LabCorp is doing in this area. So next slide. So we're going to start by kind of an easy polling question just to see as an appetizer how everybody is able to utilize the polling feature here. And so we'll start with our first question of, do you expect your business partners to participate in community health initiatives? And the answers here are simple. There's no wrong answer, but if you could reply either yes or no on your screen, and we'll give that just a few seconds for everybody to get a chance to practice here, because we will utilize this a few more times throughout the presentation. All right, maybe just a second or two more. Get your final answers in. All right, let's go to the next slide. So not that surprising, but nearly 95% of everybody here today said that yes, they do expect their business partners to participate in community health. And I think that just speaks to the culture of all the organizations that we work for and our expectations for our business partners, and that's great to see. The next slide, Heather. So at a very high level, I just wanted to mention a few things before we get into very specific lab types of things that we do as an organization to participate and engage in community health. The first bucket of things that we do is really actively participating with our partners and our clients that we serve in our community. So this may be with a public health organization, with a federally qualified health center, with a health system, with a large provider group, and it could be sponsoring events, charitable organizations. It could be our employees going and participating in an event, our phlebotomists going to those events. It could be a joint educational program. So we do hundreds and hundreds of these types of things every year. And of course, you would expect a company like us to be participating in those. The second is really direct programs that bring laboratory testing to individuals in need. So this could be done through a free clinic, through a health fair, or through something more intriguing like we've done with COVID. And one example is the North Carolina Department of Health, where eligible individuals in North Carolina that either get food nutrition assistance or have disabilities can go on to the Pixel by LabCorp website and get a test delivered right to their house that they can FedEx back to the lab, so that they don't have to go in somewhere, maybe a place that they don't have transportation to get to in order to get a COVID-19 PCR test. So we've done a number of innovative programs like that, especially throughout the pandemic. And then the third is we want to be a workplace where our employees, our 70,000 employees around the globe, they feel like their wellness is at the forefront. They feel engaged. They feel included. We have a workforce that is diverse and reflective of the communities that we serve, because we know those employees will push us to do the right types of outreach initiatives and be involved in all of the right ways that are most important to the patients that we serve. So with that, I will hand it over to my colleague, Linda, who will go a little deeper into a few more things, but I think we have a polling question first. So what challenges have you faced when trying to implement initiatives to better support health in your community? You can choose several of these, but identifying high-risk patients and gaps in care, lack of access to timely information, limited resources to implement initiatives, or other, and you can put free text responses in the Q&A. All right, let's go to the next slide and see how everybody answered. A lot of different answers, but by far the most common answer is limited resources to implement initiatives. So all of those organizations, public and private, trying to do things here and yet not enough resources to go around. We certainly understand that. With that, Linda, let me hand it to you to take us forward in our next slide.
All right, well, thank you, Brian. First, I just want to check, can you give me a thumbs up, Brian, if you can hear me okay? All right. I know there was earlier I saw some things in the chat that maybe people couldn't hear as well. So Thank you. My name, as Brian had mentioned, is Linda Frauenhofer. I'm a Director of Population Health Initiatives with LabCorp, and I focus predominantly on federally qualified health centers and public health departments. And so what I wanted to show you is some of the things that LabCorp has really focused on from a data solutions. And so if we could go to the next slide, as we were talking about and looking at building data solutions, one of the most important things you need to ask yourselves first is, well, what is the data? And, and as Brian had alluded to earlier, LabCorp does. We service, many, many individuals across the entire country. But one of the other things that I think is very interesting when you start looking at, what can a lab help with, is that when you think of lab data, even though lab isn't typically considered the most expensive aspect of healthcare, it actually is thought to influence close to 70% of medical decisions. And so you have this information that is incredibly valuable in understanding, at the patient level, what should be done or shouldn't be done. And so we thought, okay, there really could be utility in a lab-centric view for health systems. Because again, to address some of the earlier concerns on the previous poll, timely information is challenging. Well, labs are timely. It's not like there's no delay. You have the information. And so we actually focused on the key areas we looked, at high-risk patients, gaps in care, and then we also wanted to look at, community-wide. How could we transition lab from being something that's looked at predominantly as just servicing just an individual, or when you're looking at the patient, to a broader context and being that community partner that we want to be. And so with the next slide, I'll show you one of the programs that we developed is called Insight Analytics. And I share this because, a little while ago, I was chatting with a, CEO at a health system, and you start talking about data and he's like, stop, I am drowning in data, but, he has data. Data wasn't his concern. He's like, I got two questions. Who's going to analyze it? And what am I going to do about it? And so that's where, for me, it was kind of a light bulb moment. I'm like, yeah, like that's kind of like there's all this information, but how do you make that information actionable? And then how do you actually implement, what you need to do? And so that was part of what we were thinking of when we developed. And so this is just an example of our diabetes program. And so what would happen is this is on the LabCorp, on the link portal. And so any partner of LabCorp has the ability to have, be able to view their lab, their lab-centric information. And what's really great is that, I have, chief medical officers that I'll work with, and they can log in and, it might see, there's 2,000 patients that have diabetes, and the average, it kind of stratifies it. If you look over on the, on the middle there under control, you see it actually breaks it down, like where are all the patients? And so you'll say, they're like, I'm really, because again, high risk patients, that's what we're really trying to focus on, or rising risk patients. So that person, they can click, they can say, okay, I want to see all my poorly controlled diabetics that have A1Cs over 9. So they can layer in that filter. They can then look and say, okay, we've got lab-based comorbidities that we know. So for example, if I said, okay, I want poorly controlled diabetics with kidney disease, and then I look at the guidelines, because again, as the lab, we're receiving the information. We know the patient, we know the lab results. We know when you build guidelines around that, we know, well, this person, according to guidelines, they should have had another result, or they should have had another test. And so that's how we're able to, we pre-built, all the different guidelines. And so in this example, you're able to go from almost 2,000 individuals with diabetes down to 62 very specific patients that are poorly controlled diabetics with kidney disease that have an A1C that has not been, or they have not had an A1C in the last 6 months. So that becomes the actionable. It's the, kind of, again, I think back to that question of who's going to analyze it? Well, we have a platform. We can help support you in identifying those at-risk patients. But now the next part of it, and the next slide, is when we're like, okay, what am I going to do about it? And so this is where we've tried to couple these programs together where, again, very easily we can identify, the patients that have a particular care gap. But with COVID, what we saw, a lot of patients were not coming in. And so how do you meet the patients where they are? And so we actually, in response to that, developed a LabCorp at-home program. So now, that individual, with the analytics program previously, they can identify those patients that have that particular gap in care, download that to an Excel sheet. They can send that to their, care coordination team or whoever is going to be doing the outreach to try and make sure that we address this gap in care with these specific patients. And then this is now another option. It's, if the patient for whatever reason can't get into the office, or they can't, wherever, if they're having difficulties, you then can send a kit to their home. And so we can help with these specific things that it's kind of that idea of who's going to analyze it? What am I going to do about it? We were really trying to apply that, with our analytics. And I also want to add, like, one of the other things, because again, for, as Brian was speaking to earlier, when you start talking about inequities and addressing gaps in care, and so one of the other things that we did with this program is that, because I work with a lot of federally qualified health centers. And so when you talk about resources and not having the resources, yes, there are EMR, there are population health programs that are, that are fantastic, but they don't have the resources to necessarily have that. So what we've done is we've made all of the analytics that you see, we've made those available at no cost for our LabCorp partners, because what it means is that you, at a minimum, you have a lab-centric view of what's happening with your patient population so that you can then begin to address some of these steps, because the goal is to, be able to identify patients that are, if they have a gap in care, to be able to treat the patient, because we want to improve health outcomes. And it's kind of that was what we felt was a way that we could contribute, is that there is no reason that you would have that a patient, that you wouldn't be able to identify them. And so that was something I think we really felt was an important contribution from that regard. The next step we'll look at, or I think we might have a question. If we'll go to the next slide, please. So based on this discussion so far, what areas could lab analytics support implementing initiatives that your organization is engaged in? So, these might be, educational campaigns, population health benchmarking. I will say that's one I hear quite a bit. Tracking initiative progress, also one I hear quite a bit. Or if there's others that you think of, like, now if you're thinking of lab beyond just that point of just with the patient, what could we do system-wide? What are other things that we could potentially look at? What are things that come to mind that could be helpful? So we'll give everybody a second to set their coffee down and like pick what's appropriate or what's most relevant. All right. Heather, should we advance and see where people are at? Population health benchmarking. Yeah, this is definitely, that is one that I see quite a bit, as far as, just wanting to understand, like, where is our population? How do we, with the rest of the community, like, what is going on? And so those are actually some things I am excited to show you some of the other things we've been working on. So now we'll shift gears a little bit. We'll go to the next slides. And so now we're going to start getting into some of those broader, like what I had shown you previously, the first one, that was again, that's a CMO that is, or leadership at an organization, and they're using a specific, tool that's, we have different ones for diabetes, kidney disease, utilization, a variety of different things. But now we're going to think a little bit broader in how we look at that lab data. And so if we'll go to the next slide, like, this is starting to trend towards that idea of, community-based. So one of the things that, that we hear about is, you've probably heard about like antibiotic resistance. And there's a lot of concern about, are we prescribing the right antibiotic the first time? And so, antibiograms are a tool that, that have basically, we've seen them a lot. Hospitals have been using them for many, many years. And so it's a tool that helps a health system prescribe the right antibiotic the first time. It's kind of like what's happening within the organization. But the step that was perhaps missing is the community level, because now we're looking at broader than just like within the walls of an organization, what's happening beyond that. And so LabCorp actually has developed a community antibiogram where we aggregate all of the LabCorp data. We specifically exclude hospitals, nursing homes, prisons, because that's not community-based, because this is something that, the idea behind it is that we're going to be a good partner and help organizations develop. And if we go to the next, slide, so you can take this, you can identify your specific service area. And then this is an example where they were able to use the LabCorp, aggregated LabCorp information, and create a customized antibiogram that they were then able to give out to their providers that are seeing patients or, outpatients. And the idea behind it is, let's prescribe, the right antibiotic, the first time. And so that was something that we were able to, again, and it's a shift in how you look at lab data. Again, this isn't just the individual patient. This isn't even the specific health system. This is looking at a community, looking at an area, aggregating that information, and then enabling decisions to be made reflecting what's happening in that community. And so that was sort of a novel approach. And I know there's a lot of organizations now that I speak with them. They have antimicrobial stewardship programs, and this is something that they are very interested in having as a resource to help complement so many of the other initiatives that they're undertaking. So, next slide. So we'll shift now from, this was a specific service area. We've talked, we talked initially about a specific health, a health system, and then we were looking at aggregated data. Now we're going to look at, really big picture, national assessments. And again, this is looking at how can a lab help. And so what this was, we actually were looking at, so kidney disease is something that, it's kind of in the public health world, we talk about this epidemic of kidney disease, because if individuals have poorly controlled diabetes, hypertension, kidney disease is, unfortunately something that they are at risk for. And there's guidelines that exist for at-risk patients. But what the question is, okay, well, are at-risk patients being screened appropriately? And so when you think of that initial, when I showed you the scope of what LabCorp, the data that they have, to be able to look at that and say, okay, our patients, if we've got, diabetes patients, we have patients with hypertension, are the current guidelines being applied for those individuals? And what we found was that no, like less than 20% of these at-risk individuals were actually screened according to guidelines. And further, we were able to identify, well, the majority of them will get, the EGFR, which is a blood test to assess kidney function, but the vast majority do not get the urine testing. And so it's like, okay, so then the next part, of course, if we always think of data, who's going to analyze it? What am I going to do about it? Well, what are you going to do about it? Well, there was a collaboration with the National Kidney Foundation, and they actually developed a kidney profile, which standardized the testing requirements so that way, if a patient is at risk, like it created in one test code, essentially, the multiple tests that would need to be completed for a patient to be considered appropriately screened, so that you can start then just applying guidelines that exist. And so these are things that, again, we're looking to support, the local, or, looking to support, the health systems, but we also can then assess even at a national level, are current guidelines being implemented? And so that was, again, something that we were, I think, happy to help support, because it just helps to highlight, some of the things that a lab can be supportive of. All right. And then we're going to go, so we've gone national, and now we're going to go really local. So we'll go to the next slide. And so this is actually, so I live in Chicago. And so this is actually Chicago. And it's, again, trying to think of lab in a different way, where, one of the local health departments, their way that they would assess diabetes in the community was they would use hospital discharge data. And they would tell me, they're like, yeah, we know it's not the greatest, but that's all they had. And so we had this idea where we started looking at labs, or looking at A1Cs. And so we started looking at A1Cs, and we were looking at, we could look at zip code level, and we could look at, these different things that are happening. And what it does is it potentially enables, like I think to one of the earlier questions where you start talking about that benchmarking, that's what we're looking to start supporting, where, you would be able to say, okay, we've identified a hot spot with diabetes, like what kind of initiatives could be implemented at the community level, what kind of resources are needed. And we can actually say, okay, here's where we started, here's what we did, and then we can look and be, okay, here's what happened. And so that's the part, that's what we are trying to support as an organization. And so, because you'll notice, like, and again, you're probably not familiar with Chicago, but the Gold Coast area, it's a very wealthy suburb, or a very wealthy downtown. And then, Pilsen is a predominantly Hispanic community. Inglewood is a predominantly African-American community. And you see these differences, you see almost a full point difference in A1C at the zip code level. I mean, and that's if you're treating a patient, if you were thinking of it in the patient level, a 1 point difference in A1C is not insignificant. And so those were the things that we've been looking at. And I actually have another fun, if we have some time or after questions, I'll try and share. I've got another analysis where we hotspotted even beyond this, where we can look even within a zip code, you'll see variations. And so again, our goal in being a partner is to transition beyond, just, oh, yep, patient came in, lab result got sent back, and then here, yep, we give the lab result back. I think the idea is, all of us can contribute something. And so this is what LabCorp has really been focused on as far as contributing and making a difference in, from a public health perspective, and again, helping to support equity among all communities. And so with that, we'll go to the next. I think we've got another slide. So, and this is, of course, the questions we try to, how do we coordinate resources to implement initiatives that address health disparities? And so this might be, and this is kind of, I'm asking because I'm like, what would be, I've shown you some of the things that we've developed already, but what would be helpful going forward? Would integrating lab data and social determinants of health be helpful? Expanding engagement with public health departments to include chronic diseases, because we've all been working with our public health departments through the last year with COVID. So it's not that, everybody doesn't know their health department at this point, but that's been a really specific infectious disease. All the challenges that we had before COVID are still there. And so do we perhaps expand that? Enable population health benchmarking by health system and geography. Is that something that would be useful? And so those were just some of the ideas that we were looking at, again, as we all try to go in this direction, of just enabling care to be equal among, or, equitable care. How do we help support that? And so we'll see. I don't know, is that enough time for people to have clicked their selection? All right. Oh, we have almost a tie. Oh, we have a tie. Look at that. Integrating lab data and social determinants of health and enabling population benchmarking by health system and geography are areas that, would really, really be helpful. Look, and then we're looking at expanding engagement with public health departments to include chronic diseases. No, and I appreciate the feedback, because this is, again, it's something, we've started doing this, but I personally was curious, what could we do? Like, what would be helpful? And so that's actually really, really interesting. So thank you for that. All right. And with that, I think we have the thank you. And so I suspect we're going to be getting some questions. And so, Brian, would it be okay if, while we're getting the questions, since we had that one slide I couldn't show, is it okay if I share my screen and try and be able to do that while we're getting our questions?
For sure. Yeah, absolutely. And as a reminder to folks, you can enter your questions into the Q&A box you see on your dashboard, and we'll get to those after Linda finishes her screen share. Okay. And of course, it's all the fun with technology. I'm like, you guys have a system I haven't used. It's not Zoom. It's not WebEx. It's like a whole new one. So, all right. So let's see here. All right. And I'm going to share. Here we go. So this is what I'd wanted to show. And are you able to see all right, Brian? Yes, I can see it in your media player there. Yep, I'm able to see that.
So this was the part where I thought lab differently. So here was the slide we had before, but what I wanted to show the group was, again, looking at diabetes in a different way, like from can we hotspot areas? And so this was, taking a look at those areas of Chicago and looking at where do you see poorly controlled diabetes? And so that was that kind of next level of analysis that because that's what, and again, after, working with the CDC, it's health is local. Like there is, and that's one of the challenges is that the resources that exist from a public health perspective, if you look at NHANES, National Health and Nutrition Examination Survey, it's geared to be national. So while it gives you an assessment of what's happening in the country, it does not tell you anything about the South Side of Chicago. And so what can we do to help have that granular level of actionable data, and looking at, what partners do we need to have that done? So that's what I'd wanted to show everybody was, again, it's just kind of that a lot of times people hadn't thought of diabetes in this kind of way. And so I'd wanted to just kind of show you that. So with that, I will stop sharing. And I think it'll go back to, or I'm hoping it goes back to.
Yep, we can see you. Back to your video.
All right, there we go.
All right, awesome.
See?
Yeah, well done.
We're able to get through it. So
Great. And now we'll jump to some audience questions here. So the first one we'll take is the attendee asks, is there a data feed that can be leveraged for the information collected by LabCorp? It would be really interesting to use this in the context of other data already present. The example given here is social determinants of health, of course.
Yeah, and so the answer to that is yes. Option available. And so if that's something, please reach out. I'd be more than happy to help facilitate how that. So the data feed, though, but to be clear, because we had a couple different things. Like there was the pre-built analytics that I was showing you. That is not the data feed. That's the analytics platform where it's already kind of pre-built and it, you can already query it. The data feed is going to send the data, and then the organization receiving it would have that they would be then, querying it and building that. But so yes, the data feed absolutely does exist.
Excellent. Appreciate that added clarity there, Linda. And the next one is, I believe it was a free-form text response to one of the survey questions, but I think it lends itself to additional comment. So the attendee wrote, I'd like to measure progress for a population and relate it to payer quality measures.
So I guess say that again. So they're just looking at, payer quality measures. So they're looking at, was a particular test done, based on the patient's condition. So yeah, we've actually developed some of our other analytics, and I didn't show them here, but we've developed others that help, they look at the coding. And I'll go back to kidney disease because that's near and dear to my heart with the work that I'm doing in some of the public health world. What we see, and I'll speak to kidney disease specifically, is the coding. Like if you match up the lab result, like we know because it's such a lab-centered disease, we can say, we can see this patient is a stage 4 patient, but yet they're not even coded as a stage 4 patient. So you see where it's not coded. You also see discrepancies in coding where, they were coded as a stage 3, but it never got updated to a stage 4. And those become really important when you're starting to look at the different quality measures and coding, is coding being done correctly? And so those are absolutely things that we have the ability to, we have the current ability to do with diabetes and kidney disease, and there's other areas that of course we'd welcome, some of the input, just like I said, I really appreciated the slide earlier. That was kind of one of mine on what should I be focused on next? So.
Yeah, definitely.
Linda,
go ahead, Brian. Sorry about that.
No, just going to add on one example to what Linda was just saying, that we've also given provider organizations, we can show them, all of their providers, and at least with lab-centric data, where you're adhering to guidelines, at least that are publicly available. And sometimes those organizations have shown that data to the payers to say, look how great we are at following evidence-based medicine. So that's just a whole nother area that's a different opportunity to work with the payers on your quality and evidence-based medicine.
Excellent. Well, thank you both for weighing in on that one. The next question will be, the attendee asks, does your data integrate into EMRs or other CM platforms, or does an organization or provider have to work in a separate system?
Well, we have interfaces with thousands of EMRs. And so that's the typical process will be if a provider, if they're a partner with LabCorp, almost, not 100% of the time anymore, but like the vast majority of the time, there's an interface then. And so that data is flowing right directly into the EMR for the provider, for the health system. And so then it's a matter of what tools do they have to query it. So like what I've shown, like the pre-built analytics, when I showed that, the health system has all that. It's not like we ran the A1C and then didn't result it out. Like we've given them all the information, but it's how how easy do you make it, how digestible is it? And so that's been some of the things that we see are a little bit, it's maybe not as easy to get population level or organizational level views with that, just looking specifically at the lab data. But no, interfaces, that is something we've done. That's I would say, the vast majority of the time, that's yes, definitely is, flows through into the EMR.
Absolutely. Great clarity there. And some of those comments harken back to your previous comments about sort of, making data actionable, right? And making it really strong that you can move with it. So the next question, we've had a lot of great engagement from attendees, really appreciate it. So the next question is, how have you seen health systems work with you to gather and review data for the Medicare population? What type of programs have you seen be successful?
So, well, I guess, going back to the analytics that I was showing you, what we've also done or what we built in, and I didn't highlight this there, was we actually have a payer option. So if you wanted to focus on, so if that exact same thing I showed you, that concept of my poorly controlled diabetics with kidney disease that have a gap in care, if I then did the drop down and I selected, but only Medicare, that's actually something. So it enables groups to very quickly, based on, and I see that not even just with Medicare, but as there's so many groups that are, they have like different at-risk contracts. And again, my world is federally qualified health centers. And I've been even seeing some of the FQHCs that'll be having, an at-risk contract with a Medicaid population. And so sometimes they'll have an employee at the FQHC that's really focused on that particular contract. And so we have these tools then that enable them to go in. They can very quickly identify those. It's looking at the patients, because again, this is the lab-centric view. And part of what they like about it is that it's that real time. This isn't, they're not waiting for the data. This isn't this isn't something where they're waiting, because I know, claims data is what gets used a lot, but there's a little bit of a delay. And so this is something where, that if it's been resulted, it's in the system. So that's where that's what we tried to do, again, thinking from the payer, making it useful from that payer perspective as well. And so I don't know if there's Brian, and I mean, Brian Vaughn, is there anything?
I'll add one more thing to that. Medicare Advantage is pretty unique in some of the measurements and things that you look at. So in a Medicare Advantage population, Linda alluded to coding earlier. So we can show providers, payers, at-risk organizations where their coding may not be lined up against lab results, in which case maybe they need to update the diagnosis codes, be sure that patient is getting into a diabetic program or a hypertension program, things like that. And then we can also, earlier Linda showed you some of our gaps in care programs. Some of those are really important for HEDIS measures and your quality scores, especially if you're taking on MA risk. So we've actually done this for many years with the payers to help fill colorectal cancer screening gaps in care and things like that. So some very specific things we can do for that Medicare population.
Excellent. Thank you both for tackling that one. The next question then, back to some of the social determinants of health data. Are you able to integrate social determinants of health data into your analysis? If so, at what level, zip code, individual patient? So can you speak more on that?
Yeah, I think, well, to answer it, that isn't something that we've done as of this moment, but we've been exploring it. And so I think zip code level, like we have the individual information, and so we just have to figure out what's the most actionable. And so the answer is yes, capable to both. If you're asking zip code and individual, we have both. But how do we layer that in? And I think that's maybe where we're exploring that right now. So that's why I appreciated the feedback that would be, if we explore that's something that would be received with interest.
Appreciate you digging deeper on those comments there. And then the next question is sort of a $1 million question here. What steps can we do to take to avoid another pandemic?
Oh, yeah. Well, God.
That is $1 million.
Like, wash your hands. Like, I have a 5-year-old, and so, he's like, "Mommy, do we still need to social distance?" So, I think that's I think I'm going to step back and throw that one to Brian, because I don't know quite how to, I personally am like, I would love to never have it happen again, because I miss my friends and my family, and so Brian, I'm going to toss that one over to you. How can we prevent a pandemic?
Yeah, I don't know that I'm qualified to really weigh in on that either. I would say, there's a lot of probably investments we need to make as a country, as a globe, to be better prepared for the next one. I don't know if we'll ever prevent the next one, but we could probably certainly be better prepared. So, I appreciate that a lot, and hopefully we don't have to go through that again in our lifetime.
Absolutely. I didn't even feel qualified to really ask the question, so I appreciate you stepping up to the plate, Brian.
I'm glad you threw the curve.
Great. So this will be the last question then we'll take, and then Brian, Linda, any closing thoughts you want to share as well would be great. So the attendee asked, would it be possible to factor in the prevalence of uninsured patients per county or zip code on the heat maps? Access to care significantly impacts med access, compliance, and subsequent health outcomes.
Yeah, we've actually done. So again, my world federally qualified health centers, which have a large proportion of uninsured patients. And so we've actually been able to start looking at, things such as, patients that received care at an FQHC versus patients, the entire population. And so we're still working out the details, but it is something that we're definitely aware of. And we've developed some very specific programs for those FQHCs to help support their uninsured and underinsured populations to, again, it's reducing disparities in care. It's to help enable that organization when that person is there, what do they need, instead of, because so many times what happens is they're looking at like, well, I have this grant to cover this and I have this grant to cover that. And, and that would maybe influence what options or, what testing is done to assess that patient. And so that's, one of the things that I think we've really developed is a program that helps to eliminate the disparities in care from that perspective. So, but that'll be more to come on that, I think.
Certainly. Thank you, Linda. Brian, any closing comments from you?
Well, yeah, thanks, Brian, to you and to the Becker's team for helping us put this on today. Linda, of course, thank you for preparing the material here. And let me just first of all say thanks to everyone for joining, and also for what you and your organizations have done to get us through this pandemic and are doing to help us and help our communities close these health disparity gaps. They've been out there for a really long time. So just from all of us here at LabCorp, thanks for what you're doing. I know Linda and I, you can see our contact information. We'd love to hear from you. We'd love to hear use cases and things that you're working on. We'd love to hear how our data might be able to supplement something that you're doing, or you push us to combine our data with something that could be really useful and impactful for our community. So we look forward to hearing from you, and just thank everybody for the time this afternoon and for spending a little bit of your day with us.
Well, thank you, Brian, and thank you, Linda. It was an excellent presentation and a very important topic. And thanks to everyone for dialing in and engaging with us. We had tons of great questions and appreciate the participation in polls as well. I also want to thank LabCorp for sponsoring today's webinar. Enjoy the rest of your day, everyone, and we look forward to having you join us for future webinars.